Hi, my name is Marvin and I'm a PhD student from the Ruhr University Bochum in Germany. Essentially, my main research area is human-centered security and privacy of COVID-19 apps. In the following minutes, I would like to present our paper called Proof-of-Vax, Studying User Preferences and Perception of COVID Vaccination Certificates. I'm pretty sure that most of you heard about COVID-19 apps to fight the ongoing pandemic. And the best known example are probably contact tracing apps, intended to break infection chains more effectively. And the use of these types of mobile apps is usually on a voluntary basis. And as most of you probably know, there are several studies out there that already investigated the end user's privacy perception of such apps. Despite these digital tools and other measures, we have had recurring lockdowns and other restrictions, which affect the social life, freedom of travel, and many, many more areas. This already caused severe damage to the global economy. Then, as the pandemic progressed, several COVID-19 vaccines have been developed. And with the appearance of these vaccines, they also raised, in some countries such as Germany, discussions about privileges for vaccinated citizens, for example, to allow participating in major events or international air traveling. To verify the vaccination status, COVID vaccination certificates are required. And thus, vaccination certificates may help to prevent further lockdowns and in limiting the spread of the coronavirus. This emerging field of application motivated us to take a deeper look at the privacy perception and the user acceptance of different implementations of vaccination certificates and their scope of usage. We did this by conducting an end-user study in Germany, being particularly interested in studying the willingness to use of paper-based and app-based certificates. This area of research gives us deeper insights into the privacy of digital health-related data and apps, especially because these certificates store and show sensitive personal health data. And finally, investigating the willingness to use of COVID-19 apps can prepare us for future applications of vax certificates and the design of health apps in general. To better understand the context of our study and to motivate the reason to conduct our study in a European country, in Germany, I would like to give you a brief overview of the pandemic situation in Germany, in this case as of March 2021, so about 1 year after the pandemic started. There already existed some COVID-19 apps in Germany, such as the popular government-developed Corona Warn app, used for contact tracing. At the time of our study, Germany was in a strict second lockdown, lasting multiple months. This lockdown included closed shopping stores, restaurants, and travel restrictions. There were no privileges or any kind of withdrawal of restrictions for vaccinated citizens, but discussions about societal implications of privileges. To give you some more numbers for context, only 4.5% of the German population had been fully vaccinated due to limited access to vaccine. And at the time of our study, after each vaccination is given, most countries, including Germany, issued a paper-based proof of vaccination, for example, deposited within the official international certificates of vaccination document standardized by the World Health Organization. This official yellow document is already used and recognized by many countries, and I'm confident that many of you probably know this kind of document. So there was only the paper-based evidence for the purpose of documentation. And we have designed 5 different variants of vax certificates based on deployed or planned designs of paper-based and app-based variants. To evaluate the willingness to use of our certificates within specific use cases, we conducted a representative online study in Germany on a sample of 599 participants. Let's briefly talk about the design and the structure of our questionnaire. In total, our study consists of 4 different question groups. In the main part of our study, the third item in this list, we investigated the willingness to use of these vax certificates within 2 use cases. Before I will talk about our use cases, I would like to explain our 5 different conditions or variants of certificates. The first one is a simple piece of credit card-sized paper confirming the vaccination against COVID-19. The second one is the existing international certificates of vaccination document, used to confirm and verify the vaccination status of several vaccinations that took place. So both variants are paper-based and differ only in their degree of specialization. The COVID certificate app is based on a planned EU digital vaccination certificate utilizing a cryptographically signed QR code which can be easily verified by scanning to check the vaccination status. C4 is based on the health insurance apps on the design of health insurance apps, which are gradually introduced in Germany and further European countries to digitize the patient's record, also including vaccination records. And finally, C5, the already existing Corona Warn app, extended by the Vax certificate feature. So we designed 5 different between-group conditions representing different variants of certificates, which means that calculated on our nearly 600 participants, 120 participants each have seen a single Vax certificate. In our questionnaire, a single Vax certificate has 2 different within-group use cases. Within the first use case, documentation only, it is assumed that the respective certificate is used for documentation purposes only. As you probably notice, the first use case represents the situation in Germany at the time of our study. Our second use case covers a future scenario where these certificates are mandatory for privileges. Each participant got to see only one condition, but in chronological order, both use cases. And each condition and use case within our survey consists of a short descriptive text about the use case and the purpose of the respective Vax certificate, and is finally supplemented by a visualized mockup design. Okay, let's now finally talk about the most important results of our paper. In the first step, we will take a look at the participants' willingness to use of our 5 certificates, each rated on a 5-point scale. In the documentation use case, we observe that the response values, so the overall willingness to use, is generally high across all conditions. This means that there are tendencies for the participants to use any variant of certificate. Most strikingly, we observe the highest willingness to use for both paper-based variants. We also found pairwise statistically highly significant differences between each of the paper-based conditions C1 and C2 compared to the app-based conditions C3, 4, and 5. This means that both paper-based variants reach significant higher preference rates than each of their app-based counterparts. So for the documentation use case, many participants seem to value the existing certificate as sufficient. But if we change the use case, so assuming privileges for vaccinated citizens, we observe 2 significant changes. First, the significant differences between paper and app-based certificates is no longer present, except for condition C4, the health insurance app. This implies that the health insurance app is the only app that has a significant negative impact on the willingness to use and thus a lower user acceptance rate compared to both paper-based variants. Second, the overall willingness to use of vaccination certificates is still relatively high, but decreases significantly compared to the documentation use case. And we suspect that this is related to the more invasive intervention caused by specific privileges only given to vaccinated individuals. But what are the factors influencing the participants' willingness to use? To answer this question, we conducted a covariance analysis, respectively, for both use cases. Let's first take a look at predictors that positively influence the willingness to use Vax certificates, that is, being more concerned about becoming infected with the coronavirus. The same applies in case of having a positive attitude towards COVID-19 vaccinations. Participants who already use the German Corona Warn app are also more likely to use Vax certificates. But we also found factors that negatively influence the willingness to use. Participants being in an app-based condition are less willing to use a Vax certificate than participants who have seen a paper-based variant. The second factor that also reduces the willingness to use is our participants' privacy disposition. Participants who are more sensitive about their personal data handling or value health data as especially worthy of protection are also less willing to use any variants of certificates in both use cases. This effect is slightly stronger for the documentation use case. For a deeper understanding of the reasons that affect the willingness to use Vax certificates, we also viewed our participants' open-ended responses. In fact, we asked them for reasons why they would not use these certificates. Participants who have a more positive attitude towards vaccination certificates argue that those certificates might help to contain the COVID-19 pandemic or prevent further lockdowns. Others refer to their intent to protect themselves or others from the coronavirus. On the other hand, some participants who are not willing to use any variant of Vax certificate are afraid of discrimination, a two-class society, or even indirect vaccination obligation. Surprisingly, the highest number of critical responses within the app groups relate to general privacy concerns. Quote, I'm concerned about data protection, or excessive data collection on personal devices. Quote, I do not need any more data collection on my smartphone. Some participants are even more specific and argue that they do not want sensitive health data stored on their phones. Within our app-based conditions, around 34% of the open answers stated privacy concerns, but none of our participants argue with privacy concerns or the protection of sensitive information when using any variant of paper-based certificate. Most of the privacy concerns are posed for the more generalized health insurance app, and the fewest privacy concerns are mentioned in the COVID certificate app condition. This also corresponds with the estimates of our covariance analysis, where apps are our biggest negative predictor. And to conclude, vaccination certificates are considered by our participants as an effective means to fight the COVID-19 pandemic and to prevent further lockdowns. Second, paper-based solutions receive more positive responses compared to app-based solutions. And to finish the conclusion, we identified privacy as a key factor and recommend appropriate handling of sensitive health data for the design of Vax apps. Thank you for your attention, and I hope that you were inspired by some of the insights of privacy in case of Vax apps and health data.